everyone, it's me again, Saibi, your student nurse for today. So for today's video, I am going to perform a step-by-step procedure of perineal care. So what is perineal care? It is cleaning by way of washing the genitals and anal area with plain water and medicated solution. It has 5 purposes, and the first one is to cleanse the perineal area of bodily secretion and excretion. Second is to eradicate unpleasant odors. Third is to prevent skin irritation. Fourth is to prevent infection. And lastly is to provide comfort. So the first procedure is to check the client's chart to verify the doctor's order. This to ensure that you are doing the procedure to the right client. The next procedure is to identify the client and establish rapport. The purpose of this is to elicit cooperation of the client. Explanation reduces apprehension. So the third step is wash hand. Hand washing deters the spread of microorganisms. Next is to explain the procedure and screen the client. To allay client's fear and anxiety and to provide privacy and assurance. Hi ma'am, my name is Heidi Cabilin, the student nurse from the University of Mindanao. May I know your name, ma'am? May I see your ID bag po? Okay, thank you, Mrs. Smith. Today, ma'am, I am going to perform a perineal care to clean your genital area and to avoid the infection and irritation and to provide comfort. Gather all the materials needed and place it to the client's bedside. Okay, ma'am, I will assist you to lay down po. Careful po. And I will flex your knees. Thank you, ma'am.
Next procedure is drape the client, exposing only part to be cleansed. Use triangle draping method. Providing privacy can ensure a trusting relationship, thus resulting cooperation from the client.
The next procedure is to put on pair of gloves. Gloves protect against exposure to blood and body fluids. Excuse me, ma'am, can you lift up your butt? I will put the under part and the bed part. The ninth step is to serve bedpan to catch water and secretion drained from flushing the perineum. The 10th step is to wet the area with sterile warm water for soothing effect.
Using working forceps, get cotton balls soaked with substance solution and clean starting from the midline of symphysis pubis to the anus with a downward stroke. Never retrace stroke. Use a single stroke or never retrace facing a stroke has something to do with the control of the spread of infections. Then after that, get another cotton balls. Clean starting from the mus pubis in figure of 7 motion by way of labia minora down to the anus. Discard used cotton balls. Do this on the opposite side with the same stroke, but with the use of another cotton balls. Secretion that tend to collect around the labia minora facilitate bacterial growth.
Wash thoroughly with sterile warm water.
Then after flushing with sterile water, dry the genital area with gauze using the same technique.
So excuse me ma'am, I'm done cleaning your perineal area, so I'm going to get the bedpan at your back. So the next procedure is to put the perineal pad at the buttocks of the client. Excuse me ma'am, I'm going to put the perineal pad at your buttocks. Next is to reposition the client to provide comfort. Next is to do aftercare, remove the gloves to provide cleanliness and orderliness. Next is wash hand. Hand hygiene helps prevent spread of organisms. Next is to check back with clients for feelings of comfort. To evaluate if good perineal care was properly rendered. How do you feel right now, ma'am? Do you feel good? Comfortable? Thank you for your cooperation, ma'am. If you need something or you have questions, just approach me. Thank you, ma'am. And lastly, do the documentation. So that's how I perform perineal care. I hope you learned from this video. Thank you for watching.